Hey there! Thanks for tuning in. Today, I'll be talking about everything you need to know about bone cancer. First off, what is bone cancer? Bone cancer is a rare type of cancer that starts in the bones. It can begin in any bone in the body, but it most commonly affects the long bones in the arms and legs. There are several types of bone cancer, but the main ones are osteosarcoma, Ewing sarcoma, and chondrosarcoma. So, what causes bone cancer? The exact cause of bone cancer isn't known, but certain genetic mutations and conditions can increase the risk. For example, people with a history of Paget's disease, Li-Fraumeni syndrome, or retinoblastoma are more likely to develop bone cancer. Exposure to high doses of radiation can also be a risk factor. Now, let's talk about symptoms. Symptoms of bone cancer can vary, but some common ones include persistent pain in the affected bone, swelling and tenderness near the area, and sometimes a noticeable lump. If the cancer spreads, you might experience fatigue, weight loss, and bone fractures. Diagnosing bone cancer involves a series of tests. This usually starts with a physical exam, followed by imaging tests like X-rays, CT scans, or MRIs. A biopsy, where a small sample of tissue is taken from the bone, is often the definitive way to diagnose bone cancer. Treatment options depend on the type, location, and stage of the cancer. Surgery is often the primary treatment, aiming to remove the cancerous tissue. In some cases, chemotherapy and radiation therapy are used either before or after surgery to shrink the tumor or kill remaining cancer cells. There are also newer treatments, like targeted therapy and immunotherapy, which are being explored. Living with bone cancer can be challenging, both physically and emotionally. It's important to build a support system, including friends, family, and healthcare professionals. Joining support groups and connecting with others who are going through similar experiences can also be incredibly helpful. That's a brief overview of bone cancer. Remember, early detection and treatment are key. If you have any concerns or symptoms, don't hesitate to reach out to your healthcare provider. Thanks for watching, and take care of yourselves.